Welcome. I'm Dr. Ogan Gurel. You're on Insights in Medicine, presented by In Time TV. We have another great hour ahead of us with a fabulous guest and a very important topic. Just want to tell you a little bit about Insights in Medicine. Our approach is integrative. We bring together some of the world's top specialists, and we certainly have one of the world's top psychiatrists today, but integrative in the sense that we explore issues from multiple angles, particularly as they relate to the big picture in general medicine and the impact on physicians and obviously patients. And today's topic, the physical medicine implications of severe mental illness, is a very important one. First of all, of the high prevalence of mental illness in the world, but also because there are significant general medical aspects. And to help us understand this important topic, we have a very distinguished guest and a actually close friend of mine, Dr. Peter Wyden. He was my professor when I was a medical student at Columbia, so it's great to see you again.
Yes, Ogan.
And we saw each other at New York. He was at Columbia, and he was on the faculty at Columbia and a professor at Roosevelt Hospital, and then went to SUNY and was professor of psychiatry there. And Dr. Wyden, throughout his illustrious career, is now presently director of the psychosis program at the University of Illinois Chicago and a professor of psychiatry. And it's great to have you.
Well, Ogan, I was thinking, it's been a while since we've talked psychiatry, and before, when you were a student, a lot has changed in the last 20 years.
Great opportunity, yeah.
And I want to share that, actually, with you and the audience, because there's good news and there's bad news, and a lot of it, a primary care provider, an internist, can make such a difference in the lives of people with severe mental illness, because the story has changed dramatically since the 1980s. So
yeah, we were talking before, as I mentioned, Dr. Wyden and I go back, but there's been a study, for example, a CDC study, that has indicated that the average lifespan of individuals with severe mental illness is about 25 years less than non-mentally ill patients. Yeah. And that's incredibly significant.
This has been a wake-up call, and I think that I'd like to put this in the context that we've always known that people with severe mental illness have high rates of medical problems, but we were completely floored by very high-level and high-quality epidemiologic work showing that if you have a mental illness, and this was published by the CDC about a year ago, if you suffer from mental illness, you're going to die 25 years earlier than if you didn't have a mental illness. A quarter century of your life will be gone. This is also happening at a time now where, from a psychiatrist's point of view, we have lots of better treatments for people with severe mental illness. So when I was...
Psychiatric.
For the psychiatric part. So I'm seeing in my practice types of recoveries in patients with schizophrenia or bipolar disorder, types of outcomes, psychiatric outcomes, that I've never seen before. People are going back to work. They're having real lives. They're not just professional patients. Yes. Not everyone. These are still severe illnesses, but it's been very encouraging. But then, in my practice, it's terrible to see someone recover from their mental illness and then die when they're 40 or 50. And this is a wake-up call, and this is a wake-up call that all physicians should know about, that if you have a severe mental illness, your life expectancy is 25 years less. I'd like to tell the audience and you about this, and I'd like to discuss reasons why that's the case, because many of the reasons are preventable, are addressable. It doesn't have to be that. And the data, the understanding has changed. So I want to really go over that.
No, it's a very important...